Hi, we are professors from UCLA, and we're excited to talk to you about a topic that impacts thousands of lives every year, Down syndrome. So buckle your seatbelts because this is going to be an enlightening ride.
Before we dive into Down syndrome, let's first define what a syndrome is. A syndrome is a group of symptoms or behaviors that occur together, forming an identifiable pattern. Now, let's get specific about Down syndrome. DS is a condition caused by one of three chromosomal abnormalities involving chromosome 21. Trisomy 21 affects 95% of people with DS when a fetus develops 3 copies of chromosome 21 in every cell. Translocation Down syndrome only affects 4% of people with DS, where an extra part of a whole chromosome 21 is attached to another chromosome, commonly chromosome 14. Mosaic Down syndrome only affects 1 to 2% of people with DS, where an individual has some cells with the usual 46 chromosomes and some cells containing 47. Down syndrome is one of the most common genetic disorders, with an estimated 5,700 babies born each year with DS in the United States, about 1 in every 640 babies.
Now, let's talk about the effects of Down syndrome. DS affects physical traits, learning, and overall health. People with DS have distinct facial features, shorter height, and experience mild to moderate cognitive impairment. Severe cases are rare. Common challenges include a short attention span, poor judgment, impulsivity, and delays in learning, language, and speech. Physical development also tends to be slower due to lower muscle tone. Individuals with DS share physical and developmental traits including low muscle tone, short neck with extra skin, flattened facial features, upward slanting eyes, small ears and mouth, wide hands and short fingers, separated joints between bones of the skull, a single deep crease across the palm, and white spots on the iris, also known as brush field spots.
Trisomy 21 occurs due to a random error during meiosis called non-disjunction. This happens when chromosome 21 fails to separate properly when forming gametes. One gamete may receive an extra copy of chromosome 21. When this gamete fuses with the normal gamete during fertilization, the resulting zygote has 3 copies of chromosome 21 instead of the usual 2. Extra genetic material affects development and leads to characteristic features and health challenges. Some common health impacts include thyroid abnormalities, 28 times higher risk of hyperthyroidism, heart defects, congenital heart defects in about 50% of cases, neurodevelopmental disorders, higher risk of autism and early onset Alzheimer's, gastrointestinal issues, intestinal blockages and slow digestion, sleep apnea due to airway abnormalities from excess fluid in the back of the neck, and hearing and vision loss. Hearing loss affects up to 75% of people. Vision problems are greater than 50%. DS occurs when the extra copy of chromosome 21 causes overproduction of amyloid precursor protein, causing amyloid plaque buildup just like in Alzheimer's disease. This explains why individuals with DS are at a higher risk for early onset Alzheimer's. Monoclonal antibody testing target amyloid buildup in pulsatile, a hormone that improves cognitive function, attention, and executive function in DS patients.
You might be thinking, can DS be detected before birth? Yes, there are many different methods of testing. Some tests are more accurate than others. Prenatal screening tests are routine and identify the likelihood that you are carrying a baby with DS. These non-invasive tests occur in 2 stages. In the first trimester, a blood test measures PAP-A and HCG levels, while an ultrasound evaluates nuchal translucency, fluid behind the baby's neck. In the second trimester, the quad screen measures 4 substances in the blood: alpha-fetoprotein, unconjugated estriol, HCG, and inhibin A to assess risk. Another option is cell-free DNA testing, analyzing fetal DNA in the mother's blood for signs of an extra chromosome 21. A positive result requires diagnostic confirmation, which is definitive. Chorionic villus sampling, CVS, is when a sample of cells from the placenta is collected between 10 to 14 weeks of pregnancy to detect DS by analyzing the placental DNA. Another option is an amniocentesis, when after 15 weeks, a small amount of amniotic fluid is extracted. This fluid contains fetal DNA cells to identify chromosomal abnormalities and neural tube defects. At birth, doctors can identify DS based on physical features. But are there treatments? There is no single standard treatment for DS, but there are treatments and therapies that can lessen the effects of the physical and cognitive differences that people with DS face. Additionally, early intervention can improve the quality of life, such as physical therapy that focuses on strengthening muscles, improving motor skills, enhancing balance and coordination, helping individuals move more effectively and independently. Speech therapy targets language development by improving communication, comprehension, and expression, which can be vital for social interactions and overall cognitive growth. Educational support offers specialized learning programs tailored to individuals' needs, promoting language acquisition, social and executive functioning skills, and self-confidence. Medical care addresses health issues commonly associated with DS, such as heart conditions and thyroid problems, and provides necessary medication or surgeries to manage DS.
My colleagues and I recently interviewed a man with DS to understand the impacts of his daily life and family. We learned insights beyond what science can provide. Danny is 32 and lives with his parents in Sacramento. He enjoys competing in Special Olympic sports, socializing, and visiting his brothers. He lived independently with other adults with DS in the Bay Area, where he was proud of his basic cooking and housekeeping skills. Danny struggles with organization, speech, and first time interactions, needing his parents' guidance on what not to say. Danny's parents worry about the future, especially as they age and the responsibility shifts to his older brothers. A lack of local programs for adults with DS adds to their concerns. They believe Danny's growth has been made possible by the support of a compassionate community and a strong family. For Danny, kindness and inclusion make all the difference. His parents hope for a future where more communities recognize that with compassion and support, independence is possible. Down syndrome support. Organizations like DS Connect and others provide resources for families, but many individuals with disabilities lack access to support groups, especially in rural areas. Only 20 to 40% of disabled individuals have consistent access to support groups, highlighting the need for advocacy and improved resources.
Ethical concerns. Recent data shows DS rates have increased among Black, Hispanic, and American Indian and Alaska Native populations, but remain stable among white and Asian individuals. The key factors are unequal access to pregnancy termination, which varies by socioeconomic status, healthcare access, and cultural or religious beliefs. U.S. studies estimate that 67 to 85% of pregnancies with a DS diagnosis ends in termination. In 2015, the number of people living with DS was 27% lower in Europe and 21% lower in the U.S. due to elective termination. The median age of life expectancy for people with DS varies by race: 50 years for white people, 25 years for Black people, and 10 years for other. Many factors may contribute, but unequal access to proper health care seems to be the primary influence.
Here is a discussion question we want you guys to keep in your minds. Moving forward, think about how healthcare policies shape DS demographics over time.
Forward, think about how we can use this knowledge to better educate and support individuals with DS. Thank you for taking the time to learn about Down syndrome with us today. We hope this knowledge empowers you to advocate for inclusivity, awareness, and better support for all.